HMPV virus outbreak. Symptoms, how it spreads, prevention, and rising threat. Have you heard about the HMPV virus? It's making headlines recently as a serious concern, especially for children, older adults, and anyone with a weakened immune system. This virus, which can cause severe respiratory issues, is spreading rapidly, and recent reports indicate a significant rise in cases, particularly in China, causing global concern. In this video, we'll break down everything you need to know about HMPV, Human Metapneumovirus. We'll cover its symptoms, how it spreads, and, most importantly, how you can protect yourself and your loved ones. Learn about the common warning signs like fever, coughing, and breathing difficulties, and discover practical prevention tips to stay safe during this alarming outbreak. Understanding this virus and its impact is crucial in these times of rising cases. Whether you're a parent, caregiver, or someone looking out for your own health, this video will give you the essential knowledge to navigate these concerning developments. If you find this information helpful, don't forget to like the video and subscribe to our channel for more critical health updates. Stay safe, stay informed, and take proactive steps to protect yourself and your family. What is HMPV? HMPV, or Human Metapneumovirus, is a virus known to cause respiratory illnesses that can affect both the upper and lower respiratory tract, according to health experts. First identified in 2001, HMPV belongs to the pneumoviridae family, which also includes RSV, respiratory syncytial virus. Over time, there has been increased understanding and awareness of this virus, leading to more widespread testing and recognition. Human metapneumovirus is one of the respiratory viruses that we're now able to identify more easily, thanks to advancements in diagnostic tools, explained a health expert. Today, diagnostic panels used in hospitals, emergency rooms, and even doctors' offices can detect whether a patient has influenza, COVID, RSV, or human metapneumovirus. This progress in testing has allowed healthcare providers to better diagnose and understand the impact of HMPV. What are the symptoms of HMPV? HMPV typically has an incubation period of 3 to 6 days before symptoms appear. Common signs of the virus include coughing, nasal congestion, fever, and shortness of breath. It's often difficult to distinguish HMPV from other respiratory viruses because testing is usually only done when someone becomes severely ill, explained a medical expert. Those most at risk of serious complications, such as bronchitis or pneumonia, include young children and adults over 65. How does HMPV spread? HMPV spreads through respiratory droplets from coughing or sneezing, close personal contact, and touching surfaces contaminated with the virus before touching your eyes, nose, or mouth. In the US, like many respiratory viruses, HMPV cases usually peak during the winter and taper off in the spring. Most people are exposed to HMPV by the age of 5, according to experts. While reinfections can occur, symptoms are generally milder in healthy individuals. However, those with weakened immune systems or older adults may experience more severe symptoms if reinfected. How to prevent HMPV? There is currently no vaccine to prevent HMPV, so prevention relies on basic hygiene practices such as washing hands with soap and water, covering the nose and mouth when coughing or sneezing, and staying home when sick. For individuals in high-risk groups, particularly older adults, those who are frail, or those with weakened immune systems, it's important to wear a mask and consider social distancing when indoors in crowded places. Experts also emphasize the importance of getting vaccinated against other respiratory viruses, including COVID-19, the flu, and RSV. Vaccination against these viruses can help reduce the risk of co-infection and assist healthcare providers in quickly identifying specific illnesses. While HMPV can cause serious illness on its own, co-infection with pneumococcus, influenza, or RSV can lead to much more severe outcomes. During respiratory virus season, reducing the risk of co-infection is crucial. Why are HMPV cases rising in China? Like many respiratory infections, HMPV is more active during late winter and spring. This is because viruses thrive in colder temperatures and spread more easily as people spend more time indoors with windows closed. In northern China, the current HMPV surge coincides with low temperatures that are expected to last until March. Other Northern Hemisphere countries, including the US, are also seeing an increase in HMPV cases, according to an epidemiologist at Flinders University in Australia. While this is concerning, the rise in cases is likely a normal seasonal increase observed in winter. The World Health Organization, WHO, is monitoring flu-like illnesses across the Northern Hemisphere and has not reported any unusual outbreak patterns in China or other regions. The WHO also confirmed that Chinese authorities have stated the healthcare system is not overwhelmed, and no emergency measures or responses have been triggered. Is another COVID-like pandemic possible? Concerns about another pandemic similar to COVID-19 are considered exaggerated by experts, as such events are typically caused by entirely new viruses, which is not the case with HMPV. This virus is already globally present and has been around for decades, meaning people worldwide have some degree of existing immunity due to previous exposure. Almost every child will experience at least one HMPV infection by the age of 5, and multiple reinfections are expected throughout life, said one expert. Currently, there are no signs pointing to a more serious global issue. Nevertheless, health officials recommend taking precautions to avoid contracting HMPV and other respiratory illnesses, such as wearing a mask in crowded places, avoiding crowds if you are at higher risk of severe illness, washing hands regularly, disposing of tissues properly. Additionally, individuals may want to consider getting vaccinated against other respiratory conditions like the flu. In the UK, pregnant women and adults aged 75 to 79 are advised to receive the respiratory syncytial virus, RSV, vaccine, which protects against a common infection that can cause cold-like symptoms but may be severe for babies and older adults. The bottom line, as HMPV continues to spread, it's important to stay informed and take proactive steps to protect yourself and others. While the virus is a growing concern, particularly for vulnerable populations, understanding its symptoms, how it spreads, and the preventive measures you can take is crucial in minimizing risks. Though there is no vaccine for HMPV, practicing good hygiene, avoiding crowded places, and staying updated on vaccinations for other respiratory illnesses can help reduce your chances of infection. Experts agree that the current rise in cases, especially in countries like China, is largely seasonal and doesn't indicate the onset of another pandemic similar to COVID-19. With HMPV being an already widespread virus, the focus should remain on reducing the impact it has on high-risk individuals, such as young children, older adults, and those with weakened immune systems. By remaining vigilant and following the recommended guidelines, you can safeguard yourself and your loved ones during this respiratory virus season. Stay informed, stay cautious, and help prevent the spread of HMPV and other respiratory infections. Thank you for watching. If you found this information helpful, please subscribe to our channel for more tips and updates. Wishing you good health, wealth, and happiness.